Okay, so chapter 27 talks about oral pathology, and it starts on page 637 of your textbook. So what we'll be talking about or discussing in chapter 27 is first defining some oral pathology and identifying the dental assistant's role in this specialty. We'll characterize a process of inflammation, including acute and chronic inflammation. We'll identify oral lesions according to placement. We'll identify oral diseases and lesions related to biological agents, physical agents, chemical agents, as well as hormonal disturbances. We'll distinguish among some oral conditions related to nutritional disturbances, discuss oral cancer and its warning signs. We'll identify the conditions and lesions of oral neoplasms and identify some oral lesions related to HIV and AIDS. We'll also describe the conditions related to miscellaneous disorders affecting the oral cavity. So oral pathology is defined as a study of oral diseases, their causes, if known, and their effects on the body. Dental assistants do not diagnose oral pathological diseases, but may alert the dentist to abnormal conditions in the mouth. So some of the terms that we'll be discussing is first, antigenic. Antigenic is something that is capable of causing an antibody production. Palpate just means to feel with fingers. Biopsy is a surgical removal of tissue, and then etiology is the cause of disease. The body responds to disease as an injury with a process known as inflammation. Here, white blood vessels are attached or attracted to the chemicals of inflammation. Histamine brings about the inflammation processes by increasing blood flow to the involved area. And then we see things like redness, heat, swelling, and pain. The dentist often examines radiographs and does a physical examination of the area of concern. The patient's genetic and medical histories are reviewed to determine if there is a risk for a specific type of disease based on past medical conditions or family predisposition. The dentist may choose to biopsy the tissues to conduct further examination of the problem areas. All data is analyzed and a diagnosis is presented to the patient with a treatment plan. The dentist then evaluates the treatment actions to determine if the diagnosis is accurate and being impacted by the treatment. If not, a new course of action can be planned. Abnormal tissues in the oral cavity are called lesions and are further classified according to their placement in the surface of the mucosa. So there are 4 classifications. We have above the surface of the oral mucosa, below the surface of the oral mucosa, even or flat with the surface of the oral mucosa, or flat or above the surface of oral mucosa. So these are some of the lesions that are above the surface of the oral mucosa. So a blister is a raised area, usually oval or circular in shape, that is fluid-filled. Fluid leaks from the blood vessels to underlying layers of the skin following some type of trauma, such as a burn, some type of friction, or disease. Fluid also protects the damaged tissue. A bulla is a large fluid-filled blister. Now, this one is greater than 1/2 of an inch in diameter. A hematoma is a lesion caused by bleeding from a ruptured blood vessel, which appears as a raised, bruised area due to the collection of localized clotted blood. Dental assistants should watch for a hematoma after oral anesthetic. Even the best clinicians may nick a blood vessel during injection, resulting in a hematoma. The dental assistant alerts the dentist about the condition and then applies pressure to the area to disperse the blood and the tissue, which alleviates the pressure. A papule is a small or less than 1/2 inch in diameter, solid raised area of the skin. The surface may be pigmented in color and either smooth or bumpy in texture. Plaque is any raised or flat patch in the oral mucosa. This term is not to be considered with dental plaque. A pustule is a small pus-containing blister. A person may see a pustule during a non-infective acne. A pustule at the end of an eyelash follicle is a stye. Vesicles are small, fluid-filled blisters. So some of the lesions below the surface of the oral mucosa includes an abscess, which is a concentrated area of pus formed as a result of infection by microorganisms. Dental abscesses are periapical, so they are at the end of the tooth or at the tip of the root of the tooth, or periodontal, caused by microorganisms invading the membrane of the tooth. A cyst is a fluid or semi-solid fluid-filled sac. The causes of cysts are numerous, and in dentistry, they normally occur as a result of a duct leaking from a fluid-formed gland becoming blocked. Cysts can develop around the crown of an undeveloped tooth prior to eruption. Erosion is a defect left from trauma or an injury. It may arise from a person biting their cheek, and the margins of the cheek erosions are red and painful. An ulcer is due to destructions of the mucous membranes and appears as an open sore on the tissue. It may appear shallow or created deeply and is normally inflamed and painful. So these are lesions that are even or flat with the surface. Ecchymosis is a medical term for bruising of the skin or bruising of the tissue. A macule is a spot of different texture or color on the skin. A patch is an area of skin that appears differently either in color or texture. A petechiae are small spots, red or purple in color, that occur in the skin or mucosa tissue. They are also caused by localized hemorrhage. A purpura is caused by bleeding within underlying tissues. These purplish or reddish brown areas or spots of discoloration can range in size from the diameter of a pinhead up to about 1 inch. Small purpura normally are referred to as petechiae, and the larger ones are called ecchymoses or bruises. Lesions that are flat with or above the surface of the oral mucosa include a granuloma, which is associated with chronic inflammation and appears as a neoplasm or tumor that is filled with granulation tissue. The suffix "oma" refers to neoplasms or tumors. A neoplasm is a medical term for a tumor. This new abnormal growth that serves no usefulness can be either malignant, which is life-threatening, or benign, which is not life-threatening. A nodule is a small lump of tissue, either hard or soft, that is usually more than 1/4 of an inch in diameter. It may either protrude from the tissue or form beneath the surface of the tissue. So what type of lesion is a macule? This is something that is even or flat with the surface. It's a type of characteristic or classification, I should say. Okay, so these are biological agents. An actinomycosis is an infection caused by a bacterium. It is painful. It usually has swelling associated with it, pus and discharge. And a lot of the times it's because of poor oral hygiene. Actinomycosis is a microorganism obtaining access to the bone through the dental socket after a tooth removal is thought to be a contributing factor. Herpes simplex, well, there's a couple different types. We have type 1, which is above the waist. It's usually in the form of a cold sore called herpes labialis, which is what we see here in the picture. Type 2 is below the waist, commonly called genital herpes. Herpetic whitlow is a crusting ulcerations on the fingers or hands that is extremely painful, and dental assistants must exert extreme care while working with patients who have herpes. Aphthous ulcers are common ulcerations that reoccur in the oral cavity. They appear circular with yellow centers and erythematous red halos around the lesions. Patients refer to them as canker sores. Herpes zoster appears as a unilateral, painful lesions that can last up to 5 weeks. It causes varicella in children and may lie latent and then activate in a time when a person is immunodeficient. HIV and advanced cancer patients are predisposed to herpes zoster. Syphilis, a venereal disease caused by bacteria that may be treated with antibiotics, has three primary stages. The first stage shows with the primary lesion about 1/2 inch diameter that is hard and raised. The second stage begins with flu-like symptoms, followed by one or two types of lesions that are extremely infectious. During the third stage, a gummy or localized lesion appears that may occur many years after treatment, or after non-treatment. It destroys bone and cartilage. Children who are born to mothers with syphilis may have Hutchinson's incisors and mulberry molars. Thrush is a common name for a fungal infection of candidiasis in children. It appears as a white, thick covering over the oral mucosal membranes and often originates as a newborn travels through the birth canal. Treatment includes wiping the involved area and applying topical antifungal drugs to the area. Cellulitis is just a bacterial infection that spreads quickly and is associated with skin and soft tissues. It's usually characterized by swelling, redness, heat, and tenderness. We have some physical agents here that cause trauma. So denture irritation can cause hyperplasia, which is what we see on the left-hand picture. An ill-fitting denture can cause small ulcers that, after continued irritations, become fold of excess tissue called hyperplasia. An amalgam tattoo, which is what we see on the right-hand side, can occur when amalgam particles become trapped in the tissue, either during oral surgery, an amalgam application, or crown preparation procedure. A radiation injury is when a patient receives too much radiation. Teeth may be malformed, dwarfed, or without roots, depending on the stages of development. Tissues within the area may appear pigmented. Spider-like vessels may appear in the skin that appears to be atrophied. Necrosis may occur, which is the death of body tissue in the area that was radiated. It is caused when there is not enough blood flow through the tissue. This condition is irreversible. Here we have some potential issues with self-expression. Oral piercing often leads to tongue swelling and sometimes can become infected or cause teeth and tissue damage. Metal hypersensitive, scar tissue development, and problems with chewing is common. Speech can also suffer. Bacteria can be introduced and more difficult to clean, and treatments can be effective, such as radiographs. Tongue splitting gives a person's tongue a reptile appearance and can make swallowing more difficult. And as we see here with tongue piercing, a lot of times people like to chew on their bar if they have a tongue piercing, and you get lots of chipping in the teeth, which is what we see on the right-hand picture. Okay, so if a cotton roll becomes dry and then are removed quickly, what type of disorder or injury could be caused? This would be a gingival ulcer. Okay, so these are issues involving chemical agents. So an aspirin burn can occur when people place an aspirin over the root area of the tooth to alleviate pain prior to seeking dental care. I've heard of some people doing this, and it's not really advised. It doesn't really help. And what it can do is, as you can see, is it can cause the tissues around the area to burn. And that only brings more problems than it fixes. Nicotine stomatitis is where chemicals from tobacco and heat affect tissues inside of the mouth. And this is usually from pipe smokers. This causes hyperkeratinized tissues. And as we can see, these it almost looks like leathery patches. They're like little raised bumps that are, and I'm not talking about the rugae up here, but sort of in the soft palate, we see this hyperkeratination of tissue. Okay, so chewing tobacco or snuff lesions appear in the oral vestibule. This is normally the lower anterior area between the lip and the teeth where a lot of people hold the chewing tobacco. Hairy tongue is a condition where the filiform papillae of the tongue becomes elongated and appears like hairs, which is what we see on this picture here. Methamphetamine is more common than ever in today's society. This drug can devastate the oral cavity. The acid of the drug causes cravings for high-calorie carbonated drinks, leading to tremendous decay. Gingival hyperplasia occurs when the connective tissue grows over the teeth. This is common in people who wear braces or who have poor hygiene. Hormonal disturbances include pregnancy gingivitis, which is where the gingival tissues appear enlarged and inflamed. This occurs in about 5% of pregnant women. Pyrogenic granulomas can be found in anyone, although it is normally referred to as a pregnancy tumor. This overgrowth of granulation tissue is caused by hormonal disturbances. Puberty gingival enlargement is where adolescents may develop swollen gingival tissues like pregnancy gingivitis that will disappear after time. All of these conditions are temporary and clear up after the hormonal balance returns to normal. The following are tooth development disturbances. Amelogenesis imperfecta is a genetic condition of the teeth in which the enamel is discolored, partially missing, or very thin. Ankylosis is a condition in which the tooth, cementum, or dentin fuses with the alveolar bone, restricting movement of the tooth as well as eruption. Dentists may have to use a handpiece and burr to separate the tooth from the bone to remove it from the socket. This often happens in elderly patients. Just as they age, the tooth begins to become ankylosed in the bone, making extractions very difficult. Anodontia occurs when teeth are congenitally missing altogether. Dentinogenesis imperfecta is a condition in which the enamel appears to be opalescent and chips away from the dentin soon after the eruption of the tooth. Fusion is a condition in which the enamel and dentin of two or more individual teeth join together. Gemination may appear much like a fusion, but in this case, a single tooth bud attempts to divide. Macrodontia teeth are abnormally large, and microdontia teeth are abnormally small. Neonatal teeth are present at the time of birth or within the first month after birth. These teeth shed quickly because roots have not yet formed. Supernumerary teeth are extra teeth that appear dwarfed in size and shape, but normal in all other aspects. Twinning is a condition in which the gemination process has been successful and two separate teeth are made from one tooth bud. They appear as a clone of the original tooth in both shape and size. Oral tori are bony outgrowths of tissue in the oral cavity that are benign in nature. Exostosis is an enlargement or nodular outgrowth of dense lamella bone that appears on the facial surfaces of the mandibular and maxillary palates. So here we have some pictures of oral tori. The picture on the left is a maxillary torus. It's just singular for tori. And then the picture on the right is mandibular tori. And as we can see, the mandibular tori are bilateral, meaning they're on both sides of the mouth. Fordyce spots are granules that are numerous light yellow spots in the oral cavity. About 80% of the population has this, and there is no current treatment or really no reason to treat it. It's not painful. It doesn't usually have any symptoms other than it may look strange. A fissured tongue has a wrinkled, deeply grooved surface. A bifid tongue is where two lateral halves of the anterior 2/3 of the tongue fail to fuse completely, and an extra tag of muscle at the end of the tongue exists. Ankyloglossia, did I say that right? Ankyloglossia is where the tongue is literally tied and the patient is unable to lift it completely. And we can kind of see it has this little frenum on the tip. It's also known as someone being tongue-tied, makes speech difficult, and often that tissue is snipped. So who could tell me, what do you think enamel that appears opalescent and easily chips away, which is a characteristic of which disorder? This will be dentinogenesis imperfecta. So now these are nutritional disturbances. Angular cheilitis is a deficiency of vitamin B. It involves both mucous membranes and the skin. It may occur in patients who constantly lick the corners of their mouths, or if they lose vertical dimension of their face. This condition can lead to more complications because it allows microorganisms to grow in an opportune environment. Glossitis creates a bald tongue appearance and may be painful to the patient. Neoplasms are the medical term for tumor, and they can either be benign or malignant. Remember, benign means they're not life-threatening. Malignant means that they are. So a lot of times neoplasms have a great potential to become malignant. So if you see somebody with a neoplasm, you want to inform the dentist without alarming the patient. Very important. You never want to alarm a patient because you see a tumor, because it might not even be a tumor. So the dental assistant should be knowledgeable and act on recognition, which could save a patient's life if it's detected early. Some oral cancer warning signs include a sore, which is inside the mouth, does not heal in a mouth. Lumps or swelling in the mouth, on the lips, or at the neck. White tongue lesions in the mouth or on the lips, and then mouth dryness that has no apparent reason. Other oral cancer warning signs include numbness in or around the mouth, soreness or burning sensations in or around the mouth, difficulty speaking, chewing, or swallowing, and repeated bleeding in a specific area of the mouth for no apparent reason. Some types of neoplasms include leukoplakia, which results usually show hyperkeratinization, but it could also show dysplastic cells. There is a controversy over whether this is a pre-malignant condition and should be examined periodically for any changes. So leukoplakia is a white leathery patch that cannot be identified as any other white lesion. Usually a biopsy is required for further identification. Lichen planus initially appears on the lower leg or ankle. In the mouth, the oral lesions begin as small white papules that group and form interlacing white lines, which is called Wickman striae. Erythroplakia is any red patch of tissue in the oral cavity that cannot be associated with inflammation and is a very dangerous lesion. It is most commonly can be seen on the soft palate, retromolar pad area, or the floor of the mouth. It usually is found in patients over the age of 60 who have used tobacco and alcoholic beverages chronically. Squamous cell carcinoma is a cancer of the squamous epithelium, and its benign form is called a papilloma. So on the left, we have a basal cell carcinoma, and on the right, we see a papilloma. It's this little raised, leathery white patch. This is what a fibroma looks like. It almost looks like a maxillary torus, but it is a neoplasm, and something like that should be biopsied for further identification. Candida albicans can be found in people who have AIDS or have had prior cancer treatment. This is a fungal a fungal infection, and patients often report a burning sensation in the infected area. Kaposi sarcoma is found in AIDS patients and was uncommon until the late 1980s. It spreads rapidly, and treatment is low doses of radiation and/or chemotherapeutic drugs. Hairy leukoplakia appears like candidiasis, but cannot be removed by wiping with the gauze. It is not painful and no treatment is available. Acute necrotizing ulcerative gingivitis, also known as ANUG, is a condition seen in young adults and teens. A mucosally is found usually on the mandibular anterior lip. Barrett's is a condition primarily seen in the elderly. The normal blood vessels become weakened and extended here. Geographic tongue is found in less than 2% of the population. And this is where we have inflammatory patches on the tongue that resemble the map of the world. Some miscellaneous disorders include anorexia or bulimia. Anorexia is a disease where a loss of 15% of the body weight occurs, and there is an intense fear of being fat. Bulimia is an out of control eating followed by vomiting. And so some of the signs that we'll have or we'll see with anorexia or bulimia are decalcified teeth, eroded enamel, deterioration of existing restorations, rampant caries, or enlargement of the parotid glands. And this is because of the acid that commonly hits the back of the teeth during vomiting. And we see it a lot in bulimia patients. And then Bell's palsy is a temporary paralysis of the muscles on one side of the face. The cause is unknown, although relations to shingles may have been found. All right, so this is all I have for chapter 27. Thank you for listening.